I welcome everyone. Thank you for joining us today on behalf of AAPCHO, Nashua, and our wonderful speakers. We thank you for joining us today. I'll give maybe a minute or two for folks to get into the room. I know that transitions between meetings can take some time, but we are going to definitely start soon because we have wonderful speakers and we want to dedicate the time to them. I am going to share this screen in case you do want to join us through your phone instead of your computer audio. And if you need this information, I'm going to leave this on. And then you can see the logos of the folks who are speaking today. And feel free to introduce yourselves as well as you're coming in. You can introduce yourselves in the chat by sharing your name, your organization, if you're affiliated with one today, where you're joining us from, and your preferred gender pronouns. I'm John Nguyen, I'm the Associate Director of Health Equity at AAPCHO. I'm based in Oakland, California. I go by he, him, and his. Again, welcome.
And my name's Aurora Grant Wingate. I work for the National Association of Community Health Workers. I use she, her pronouns, and I'm based in Massachusetts. Thank you all for coming today.
Good morning. My name is Elaine So. I'm a community health worker here at the Ko Kalihi Valley Clinic in Honolulu, Hawaii.
Thank you, Evelyn.
Thank you. Your turn, Nabi.
Aloha, good morning here, good afternoon there. My name is Nabein Oli. I work at Ko Kalihi Valley Comprehensive Health Center. I work as a community health center. I'm in the care coordinator and community health worker. Thank you.
Thank you, Nabein. Evelyn and Nabein, I'm gonna turn off your cameras for now, and then I'll bring you back in when Kikivi is talking, and I'm really excited to hear from you. All right, please, as people are coming in, feel free to share, introduce yourselves through the chat. Panelists, feel free to do that as well. You'll definitely get a chance to introduce yourselves later as well, but if you'd like to share the information now. Okay, so throughout the webinar, please feel free to send in questions, comments, insights, and any resources that you'd like to share in the chat or the Q&A box. We will try our best to bring them into the presentation. As well, we will keep the room open for an extra 15 minutes at the end of the program, the 15 minutes after the hour, for additional Q&A for the speakers and attendees that can stay. And also, we will be sharing the links in the chat throughout the webinar. And of course, we'll send an email with the slides and also the recording for this after. I'm going to go and move forward. Before we start, I do want to acknowledge that we stand in solidarity with Asian and Asian American community. We are deeply concerned about the increasing number of incidents of hate toward Asian and Asian American communities. We are horrified about the shooting that happened in Atlanta, and we are committed to providing support to affected communities across the country, and we continue to fight racism and discrimination. We continue to acknowledge that the racism is a public health crisis affecting Asian Americans and Native Hawaiians and Pacific Islanders and other communities of color. AAPCHO stands with our community, our health centers and advocates. Please let us know how we can support you. Later on, I'll share some links to some organizations that are helping to fight the anti-Asian racism. Okay, so for today, thank you for joining us to hear our wonderful speakers. And these are our learning objectives. We want to educate we hope that you're educated on the diverse needs and perspectives of Asian Americans and Native Hawaiian and Pacific Islander communities. Today, you'll hear community stories and the wonderful ways the speakers are serving their communities. There may be some common themes shared, but it's also a great opportunity to recognize the differences of experiences across Asian American and Native Hawaiian and Pacific Islander communities. We also want to explore the shift. We want to explore and shift the narrative from vaccine hesitancy to the systemic needs of the communities in order to get vaccinated. We hear a lot of concern about the desire or hesitancy in many of our communities to take the COVID-19 vaccines. Today, our speakers will reflect upon that and also explore the root causes and barriers that are impacting perspectives, access, and health decisions. Also, we want to recognize the importance of community health workers and their role in the community health outcomes. Community health workers are the trusted health educators, navigators. They are the trusted messengers and stewards of health because they are serving in the communities that they identify with and are part of. We also acknowledge that there are many other needs and experiences in Asian American communities and across Native Hawaiian and Pacific Islander communities and islands. Please feel free to use the chat to share your experiences, insights, your knowledge, and any resources that you think might be helpful for others throughout the webinar. AAPCHO, if you're unfamiliar with us, we are the Association of Asian Pacific Community Health Organizations, and we're dedicated to promoting advocacy, collaboration, and leadership that improves the health status and access of Asian Americans and Native Hawaiians and Pacific Islanders within the United States, the US territories, and the freely associated states. We currently have 32 member community health organizations and our other key partners and networks that serve the communities I mentioned. We have 3 focus areas, health equity and access, where we advocate for policies and offer programs and services which are tailored to the cultural and language needs of Asian Americans and Native Hawaiians and Pacific Islanders. Training and capacity building, where we collaborate with our network of member health centers and broad partners to provide training, technical assistance, research, and other capacity building programs and services to organizations to support them in providing high quality and accessible care. And finally, healthcare quality and innovation, where we collaborate with our member health centers, community partners, policymakers, where we work to help ensure that Asian Americans and Native Hawaiians and Pacific Islanders in all communities have access to high quality healthcare and aim to improve health outcomes and public health overall. Please visit our webpage to learn more about our members, our partners, and our work at aapcho.org. Next, I'd like to bring Aurora to talk about NACHWA.
Yes, hello. Once again, my name is Aurora Grant Wingate, and I am the Member and Partner Engagement Coordinator at the National Association of Community Health Workers, or NACHWA. NACHWA seeks to unite all community health workers nationally to support communities in achieving health equity and to unify the voices of community health workers and strengthen the profession's capacity to promote healthy communities. First and foremost, we are a membership organization connecting individual CHWs, CHW organizations, and allies. I want to thank everyone at AAPCHO for inviting us to be a part of this event and giving such a great platform for community health worker stories and knowledge. If people have questions about NACHWA, please feel free to reach out to me. My email is on the slide, or please visit our website, and I'll hand it back to you, John. Thank you.
Thanks, Aurora. All right, so I'm very excited to get us to hear from our speakers. And first, I'd like to introduce our first speakers. Anyway, I'd like to introduce our first speakers who are joining us from Ko Kalihi Valley in Oahu. Ko Kalihi Valley Comprehensive Health Center is a member of AAPCHO, and the team will share some of their efforts to reach their deeply diverse patient community. Let's welcome Nabin Oli, Lizelle Dait, Evelyn Soas, and Dr. Nathan Tan.
Hi, my name is Nathan Tan. I'm a family physician here at Ko Kalihi Valley, and I'm a member of our COVID response task force. I just wanted to briefly introduce our organization and tell you a little bit about KKV, and then we'll talk a little bit about our COVID response and then our vaccine outreach. Ko Kalihi Valley serves the Kalihi Valley area, which is a working class neighborhood of Honolulu, Hawaii. It's an area, a neighborhood that's rich in culture and very resilient too as well. We serve primarily Asian and Pacific Islanders. 97% of our patients are Asian and Pacific Islanders. Our three largest groups would be Chuukese, Filipino, and Samoan. You know, within our patient population, we have a variety of health issues that our community face, from housing insecurity, food access, access to healthcare, language issues of language and being able to access health information, and then a high chronic disease burden. We have a variety of health services that we provide, as well as community health programs. So I'd like to introduce first Nguyen, who will talk briefly. We'll talk about our COVID response in the last year. Nguyen, I think you got to unmute yourself there.
Oh,
There you go.
can you hear me?
Yes, we can.
Aloha, good morning, good afternoon there. I'm Nabeen. Thank you, Dr. Tan. You know, when it comes to experience, I guess we have wonderful experience here at, you know, Ko Kalihi Valley while working with our community. When I say wonderful experience, that means we have some successes and we have some challenges, you know, the opportunity that we like to work with. So when it comes to successes, you know, we have been doing our community outreach effort, you know, outreach, reaching out people, you know, especially where we're really bothering and we're really thinking of our unreached people, you know, homebound patient, bedbound patient, you know, a lot of family member will living with their multiple complex medical situation. And then, you know, as we mentioned earlier, we call ourselves community superpower, you know, like community healthcare worker. Myself, we have navigator, we're a case manager, we are care coordinator. We always try to reach out those unreached population. And then we also have, you know, setting up public health messaging through the education in terms of, you know, reaching out to our people, educating, and, you know, that will help empowering our population through the telemedicine, telehealth. And then we have established, you know, with small funding opportunity for the providing telephone, and then small basic like smartphone, and then flip phone for our community, for our member who doesn't have access for a phone. So that way we can reach out to them and they can reach out to us whenever they need something. And also we're reorienting existing community program to respond for the COVID-19, as we know that this has been hit very, very badly to our community, especially for the Pacific Islander and the underserved population. And we have turned our couple of hub to the food hub, because that's something we realize, the food insecurity and then other resources for daily living has been very challenged for our population. That's something we have been dealing with for last almost a year. And then we have been doing testing and tracing very effectively to our population, you know, regardless of whether they are our client or not. Some of our family member, they never come to us, but they still live in our community. So they are part of our, you know, our community. So we try to reach out whenever they come in. We try to help them when it comes to testing and contact tracing. That way we can help them whenever they are facing challenges of, you know, isolation or quarantine issues. And we also support them, everything they need, you know, from like a lot of our folks, almost 50% have lost their job. And then they have economic issues, others, you know, social risk factor that they face every day. We help them, you know, to support whatever they need. And we also, telemedicine and telehealth has been working wonderful for our population. That way, it's not only COVID-19, since we serve, you know, multiple medical situation, complex situation for them, socioeconomic issues, they have means of communication, means of, you know, reaching out to us whenever they need something. For example, simple appointments, you know, referral appointment, whenever they need food or some other supply for their family member, for other support. So that way we know what's happening there, and then we can support them on timely manner. And we try to maintain, connecting to our social media and Facebook, telephone, and sometimes the most one we really working well for us is talk story. It could be through the phone call, or sometimes directly, in-person meeting. We do that. That's something has been working very well for us, talk story. And then challenges, that's something we have been, working with. Health literacy education, under insurance, healthcare access, because 30%, almost 30% of our population has been still, struggling getting, healthcare access in terms of getting insurance. And then the technology access, technology has been success as well as challenges, the challenges in a way that, a lot of our folks have no idea, they have no access to phone when it comes to smartphone. That way we can help them, teaching, providing basic phone and smartphone. That way they can use, whenever they need to reach out to us or their family member or their good friend, so that way they know what's happening around, what's happening, what others are doing, that way.
That's great.
Am I time
you're doing great. So maybe another 30 minutes, or not 30 seconds, and then we'll talk a little bit about our vaccine.
Thank you. And then we're also family member for schooling, community activities for elderly, and that way we can help control or avoid social isolation and feeling alone for our special population, especially for disabled. And since our population living in a multi-generation household, that way we help them. They need all the care, everyday living. I guess that's it. Thank you all.
Thanks, Nguyen. Thanks for giving us a high level view of what we've been doing. Lizelle has been really involved, so I think our next thing is just to talk briefly about our immunization. Lizelle, Evelyn, both have been involved. I'd like them just to say a few words about our vaccine effort. Maybe I'll start. Lizelle, why don't you go ahead and start? You have to unmute yourself, and you can go ahead and talk a little bit about our vaccine effort.
Aloha everyone, my name is Lizelle. I work as a community health worker here at Ko Kalihi Valley, and I work with the elder care program. So with our perceptions about COVID-19 vaccines differ, and for most vaccines, there are people who will get vaccinated with no questions or no hesitations. There will be some of them who have hesitations and just needs their concerns to be addressed. And there's also those who will say, oh no, I don't want to take the vaccine. And those are the people who are strong against the vaccine. So here at KKV, we have generated the list of our patients that we need to outreach. And so we call these patients and educate them about the COVID-19 vaccination and inform them that KKV is now offering the COVID-19 vaccine, and if they would be interested in signing up and taking the vaccine. So as we call our patients, and do more of the outreach, some of the common reasons that patients are concerned about the COVID-19 vaccine would include fear. So fear about the safety and effectiveness, of course, because this is a new thing, and there's so much more to learn about it. And also some reasons would be because of the fear about the possible side effects that they may experience, and some of the beliefs that they will contract the virus from the vaccine. So a lot of the seniors that we serve heard from media or from fake news. So as a community health worker, I have seen and heard these concerns. And it's very important to understand our patients' concern and should try to meet them in the middle and build our trust. For example, asking the patient, oh, what have you heard in the community? It's like a way to find out what they may be thinking, giving our patients the opportunity to voice out their concerns or concerns that they may have. For example, I called this patient, and at first she would decline the COVID-19 vaccine because of something she'd seen or a family member would have seen online. So when asked how they were receiving this information, they would say, oh, someone posted from Facebook, or I've read about it from Facebook, or I've seen a video from YouTube. So I believe that a reputable sourcing of information is very important. And as a community health worker, we do our best to provide accurate vaccine information. We promote the language that resonate within our community that we are trying to reach. We are very fortunate here at KKV because we have a very dedicated outreach team, and the staff are bilingual because many of the patients that we serve here have English as their second language. And another example, I would be calling this patient, and he was concerned that his pre-existing conditions would lead to more complications, or he would have experienced more of the side effects. So of course, this patient with several underlying health conditions would have even a higher risk of hospitalizations from COVID, and thus exactly are the ones who need to get vaccinated. So addressing patients' fear about side effects is really important. And some will simply say, oh, I need to talk to my doctor first. And of course, we encourage them to do so.
That's great. So we have 3 panelists, but I think maybe we can save Evelyn, maybe if you'd be available at the end for some questions. I know you have some really good things. Evelyn is one of our Chukie's community health workers, and she's done some really great work and has some really great insight. Just generally, just the last thing to say is that I've been experiencing a lot more vaccine interest amongst our community members, and more than we anticipated. So anyway, thank you very much for letting us speak, and also letting the voices of our community health workers speak. Thank you very much.
Actually, thank you, Dr. Tan. I'd love for Evelyn to speak now, and we'll definitely have the recording available. But
great, if there's time. Thank you.
Evelyn speak now. Yeah,
that's great. Thank you very much, Evelyn.
Okay, thank you very much. Okay, speaking of my experience, I'm going to talk about the vaccine outreach to the Chukies. Step forward as a community health worker, there are many questions. One in particular, after I introduce or call patients about this vaccine, they'll ask, what do you think? Others hesitated because of what they've heard. Others are desperately seeking it and wondering when their turn in line will be. On December 29, I received the first dose of Moderna vaccine. After receiving the shot, I was told to wait in the area for 15 minutes to watch for reactions. Symptoms I was warned about, side effects. However, the symptoms I was experienced were similar to those side effects we had back home in Chuk State when they gave us prevention flu shot or flu vaccine. I'm not so sure if that's similar to the vaccine here. I posted on Facebook the video of me taken during that time I had my first vaccine. This is to give them strength to the community and to keep positive thinking. Our social structure, because of our culture, did not let me know their answers right away. Instead, they have to ask or talk to the head of household or the leaders of the church. And for me to make things faster and smoother, I arranged a meeting with the pastor. And when we talk about what I have to talk with him, I told them about our KKV clinic. And Sunday is the best time for everybody. They always reserve a space for you or me to speak during Sundays. Thank you very much.
Thank you, Evelyn. I'm really glad that you're able to share it right now, and it's so much to learn from you, and appreciate the work that you're doing. I want to thank everyone that spoke: Nabin, Evelyn, Lizelle, Dr. Tan. If you want to get more information about KKV, this is the information. Again, we'll share it in the chat, and we'll also share it in our in the recording and the slides. And then again, they'll be available for some questions after the hour for a few minutes. All right, thank you again. So now I would like to introduce Elaine So, CEO of Asian Services in Action in Ohio. They are another member health organization of AAPCHO, who will share what their health center is doing for communities in Cleveland and Akron. Welcome, Elaine.
Thank you so much for welcoming Asia to this conversation. So as John said, I'm Elaine So. I am the CEO of Asian Services in Action. We have an international community health center, and I'll be sharing about what we have observed in terms of COVID vaccination uptake. So Asia was founded in 1995 unofficially and 1996 officially by a group of Asian women who wanted to help Asian Americans and Pacific Islanders, immigrants and refugees who they saw struggling to integrate in the US to improve their lives in Northeast Ohio. So initially, these women that included a nurse, a social worker, and a businesswoman, they initially performed community health screenings at health fairs across Northeast Ohio. And then, as an organization, Asia learned about community members that were traveling out of state to access culturally and linguistically focused healthcare. And so leading up to 2013, Asia applied, and we were so overjoyed in 2013 that we became a federally qualified health center at that time. Next slide. So, I'm over the course of the past year, we have seen enormous disparities in COVID vaccination among communities of color. In Ohio, communities of color have been vaccinated at, disproportionately lower rates than whites. But FQHCs like Asia's ICHC have been very successful in connecting vaccines to Black, Latinx, and AAPI communities. So we are vaccinating at one of our clinical sites, and 93.6% of the vaccines that we are administering at Asia's ICHC are going into the arms of AAPIs, compared to less than 2% of vaccines that are administered by the local public health department. Next slide. And we believe that the outreach that we are performing through our community health workers is having an enormous impact on whether community members are willing to accept the vaccine. So we have, as an organization, we have community members that represent the Chinese community, that represent the Nepali speaking community, and also that represent the Congolese refugee community. And what we have observed is that older adults that have lived in the US longer have a higher vaccine uptake compared to younger, newer arrivals into this country. So among the Chinese immigrant community that is living in Northeast Ohio, there is a very large number of inquiries from the community seeking to be vaccinated. So much so that it was surprising. It was surprising to learn that some of the younger community members, even within the Chinese community, were not interested in getting the vaccine. And one method that surprised me among that particular community was that it was the older adults in the Chinese community that were convincing the younger Chinese community members to get vaccinated. And they did so by getting vaccinated themselves. And now that the state of Ohio is opening up the vaccine for all ages that are able to receive the vaccine, so anyone that is 16 and older, the vaccine will be available to all of those age groups starting next Monday. I apologize, next Monday, the March 29th. So it has been helpful for community members to encourage each other to get vaccinated. And what's impressive to me is that it's the older community, the older Chinese community, that is leading that effort. So among the Nepali speaking community, there is Nepali speaking refugee community, there is a kind of mixed response. So there are community members who believe that the vaccine causes them to get sick. And, I polled, there was a reason that I wasn't able to get vaccinated. I had mistakenly gotten vaccinated for the flu a couple weeks before my team was going to get vaccinated. But I had rode on a group van where we were going to get vaccinated by the local public health department as people working in the health setting. And so because I was waiting for them, I was kind of observing people who were either getting vaccinated or not getting vaccinated at the local public health department. And so I was polling them. Just kind of surveying them, asking them, why did you get the vaccine? And why did someone not get the vaccine if they were accompanying someone who was vaccinated? And the mixed responses that I received were everywhere from the vaccine, it doesn't prevent getting the illness because there's so many variants. And so so they chose not to get the vaccine until more is understood about the illness. And it was very helpful when our community health workers were vaccinated, and they, we had a small campaign of having people show their vaccination card, blocking out all personally identifying information, of course, but just kind of showing their vaccination card as a type of solidarity in getting the vaccination. And so we had some images of our community health workers, with their badge of courage in getting vaccinated, and that was helpful in encouraging some of the community members that were hesitant to get the vaccine. Now, I recognize that this webinar is focused on the Asian American, Native Hawaiian, Pacific Islander community and the response to the COVID vaccine, but Asian Services in Action serves all immigrants and all refugees across Northeast Ohio, and one of the communities that we serve is the Congolese community. So I'd like to just kind of add one other observation about COVID response and vaccine hesitancy and uptake in the Congolese community. So, each week, we're vaccinating individuals in the community, and as you saw the earlier statistic about nearly 94% of the population that we're vaccinating is from the AAPI community, but the rest of the percentages are either white or Black, and we include among Blacks for purposes of the statistic, Africans from Africa, like the Congo, and even though we are vaccinating Blacks, we are not vaccinating any Congolese community members because they do not believe that that COVID is a real threat to their health, and they do not believe that it is a the public health crisis that we know it to be. So it has been a challenge to for our community health workers who are Congolese to outreach to their community and encourage them to get vaccinated. So one reason I think, though, is that even our Congolese community health workers, they themselves are not vaccinated, and it is a difficult message to convey about getting vaccinated, or encouraging someone to get vaccinated when you're encouraging someone to get vaccinated and you yourself are not vaccinated. So that is a challenge, but something that we do know from the other communities is that being vaccinated yourself and encouraging someone within your community to get vaccinated through the message that you have been vaccinated is one that's very effective. So that has been our continued strategy, and so far, as you saw from the statistic, it is effective and working. So next slide, please. So so this is how you can contact us. And I apologize, my community health worker was out doing some outreach today, so she wasn't able to join us. But if there are any questions, I'm happy to answer them.
Thank you so much, Elaine. I appreciate you sharing the work that you were doing, and through the chat, the messages of many people who are also appreciating that you talked about the Asian American, Native Hawaiian, Pacific Islander experiences, but also for the Congolese and other refugees. So thank you for sharing. And please, if you have any questions for Elaine, please send them through the chat or Q&A. And now I am going to call back in Aurora, who will bring in our next speakers.
Yes, thank you so much. I'm very pleased to introduce Lucy Nguyen, who's the program manager at the Austin Asian Community Health Initiative. You can go ahead and take it away, Lucy. Thank you so much.
Hi, everyone. Hope everyone is taking care of themselves today. My name is Lucy Nguyen. I use she, her, hers pronouns. I'm a community health worker and a program manager at the Austin Asian Community Health Initiative, or AAPCHO for short. And we're based out in Austin, Texas. A little bit about AAPCHO. We are a 501c3 nonprofit founded in 2006 with a mission to improve the health and well-being of Asian Americans in Central Texas through advocacy, education, and support. I specifically manage our community health navigation program, which was developed from an unprecedented study with the city in Austin on the health of Austin's historically underserved Asian community. The study included disaggregated Asian experiences, which revealed a lot of poor health service utilization and health promoting behaviors across the AAPI community sub-ethnic groups in Austin, Texas. From that study back in 2013 to now in 2021, our community health workers, we currently employ and train 7, serve the Austin area refugee and immigrant communities through a cultural and linguistic lens. And we serve 6 different language communities, including Arabic speaking communities, specifically Iraqi and Syrian refugee populations, Burmese, Chinese, Korean, Nepali, and Vietnamese communities here in the greater Austin area. They provide a plethora of different short and long-term health navigation services, including patient and community advocacy, of course, health navigation, a lot of appointment scheduling, assistance at those appointments, transportation. Right now, we're doing a lot of COVID vaccination scheduling for our communities, interpretation and translation support at those medical appointments, but also other social service related appointments as well. referrals to local resources to their whatever basic needs that they might have, and then eligibility and application assistance for our community members. And this looks a lot like social service benefits like SNAP and Medicaid. We help a lot with immigration related needs, financial assistance right now that's been exacerbated by the pandemic, and then affordable housing. Next slide, please. During the last year, we have obviously directed much of our efforts to COVID-19, whether that is testing or vaccination navigation. We recently partnered with our local city health department to really better understand the concerns, attitudes, and barriers the AAPI communities face in Austin in regards to the vaccine access, and really learn from those responses and develop a plan to better ensure vaccine accessibility. We provided the survey in 8 different languages, including English, so all the languages I had spoken about earlier, including English and Hindi. We were able to receive over 1,000 responses in just a little bit over a week, so we're able to get some really good information from that. This slide just includes a few of the takeaways from the survey, but what we did see was that a majority of the survey respondents were interested in taking the vaccine. Only 12% did not want to receive the vaccine, and what we noticed in that, because we were able to disaggregate some of the data, is that a large majority of the Arabic-speaking community that took the survey were not interested in the vaccine. But for across the board, all other communities that we surveyed were very much so interested in taking the vaccine. Even though there was a lot of interest in taking the vaccine, more than half of the respondents had concerns about the vaccine's risks and side effects. To note, though, is that in the English portion of the survey, or people who took our English survey, majority of them did not have concerns. And so for us, it feels like there's a lot of language access to these vaccine resources. And then when we disaggregated the data, it all pretty much looked very similar across the board for all the communities. And then in terms of barriers to accessing vaccine appointments or the vaccine itself, 43% of respondents did not know how or where to schedule a vaccine appointment. And so we did see a lot of community members who are trying to get the vaccine but are unable to utilize the scheduling systems that are in place. So a lot of them are on the internet or in a way that's not accessible for our communities. And the communication surrounding vaccine appointments and vaccine scheduling is not available in their preferred language. Other barriers that were notable were that there weren't any appointments available for them. So a lot of the times, at least in Texas, or in Austin, you have to sit by the computer and really refresh to see if there's any availability. And our communities just don't have the time or time to actually spend doing that, or maybe even like the digital literacy to do that. And so even if they're able to access the system, they're not able to spend the time to find an appointment. Next slide, please. So in addressing the concerns and barriers reported in the survey, our solutions are really to create linguistically appropriate and timely vaccine information for our community. Currently, we are using multilingual resources that are from the FDA and CDC to really combat the concern of not having enough information about the vaccine's risks and side effects. But we are in the process of translating our own resources so that we can have we can address the vaccine concerns in a more local context, and also provide more vaccine access information in a more local context. I believe they should be linking some of the CDC and FDA resources in the chat, along with our website, where we will be including our resources as well. And we do include just basic COVID-19 testing and financial assistance programs, things like that in our COVID-19 resources. We're also trying to make sure that we're meeting the community where they're at. And so So our CHWs, they're embedded within the community they serve and are working to spread these resources in the physical and virtual spaces that these communities already congregate and feel comfortable receiving information. Our survey also showed that a lot of the communities that we're serving receive their information through social media, through messaging apps like WeChat, KakaoTalk, WhatsApp, and it really did depend on the community. They all use different messaging apps, and then also the power of word of mouth. So they were getting a lot of their information from their friends and their family, and so making sure that we're accessing those spaces, those cultural spaces, to ensure that we're providing them the most accurate and trusted information so that they can spread those messages. We're also working with our local health partners to address those language and cultural barriers that our communities are facing in accessing the vaccine by just ensuring that there is more language accessible registration processes and interpreter services at the vaccine distribution locations. We are not a organization that can provide the vaccine, and so just knowing that our communities are once they get a vaccine appointment, once they get to the vaccine distribution location, they might have to sign intake forms or go through a process where they're not able to interact with the person who is helping them because of a language barrier. And so that really does restrict their ability to go to an appointment without having someone who can speak English with them. And so it limits their ability to schedule appointments. Another solution is to provide, to organize mobile vaccine distributions for our communities that are in the target areas that our communities are already at. So really working to address having these accessible vaccination distributions for these communities. I will say that within the Austin area, about 5% of our of the people that are vaccinated are identify as Asian American, and so that roughly is really close to like the geographic demographic of Austin. However, because that data is not disaggregated, if Asian community is a very large community, we are not able to really understand who in the Asian community is actually being able to access the vaccine. In Austin, about 32% of Austinites, are limited English proficient. And so, from what we've seen in our interactions with the community and our survey and what we're seeing in the data, there's some missing gaps there in terms of really understanding who in the Asian community has not been able to access the vaccine and are having these barriers. Next slide. And this is just, if you are interested in learning more about AAPCHO, here's our information here. And if you guys have any questions about our survey results, I know that I've only was able to provide just a little bit of what we learned. Please feel free to email me.
Thank you so much, Lucy. Thank you for sharing your expertise and for being here today. If people have questions for Lucy, please feel free to put them in the Q&A inbox or the chat. Next, I'm very happy to introduce Amelia Vernon from the Asian Pacific Islander Forward Movement. Take away, Amelia. Thank you.
Good afternoon, everyone. I'm Amelia Vernon, she, her, hers pronouns, and I am a community health worker with the Asian Pacific Islander Forward Movement based in Los Angeles, California. I'm also one of the community engagement liaisons with NACHWA. So in the first couple of slides, I'll be going over who we are at API-FM and some of the efforts we've been taking since the pandemic began. So API Forward Movement envisions a world where API communities and all communities of color have full power to access good health and a healthy environment. Our work at API Forward Movement is very comprehensive and includes healthy food access and education, culture and community health, advocacy for APIs, including data disaggregation, and environmental justice. And can you move on to the next slide, please? Great. So this here is an overview of how our work has changed with the pandemic this past year in regards to our outreach to the API community. So there's been a wide range of programming and topics, and these are a few I just mentioned, such as the role we play in food distributions, virtual education programs on the right, and our community health worker program in the middle, which I'll go into more detail about. So it was difficult at first with everything being remote, but because of continuing to coordinate food distributions, hosting testing sites and other efforts like free PPE and resources, that helped us build rapport with folks. So when we began making calls to gauge interest in the vaccine, people were willing to have those conversations, and some reached out on their own to us as CHWs asking, you know, where can I get the vaccine? When can I get the vaccine? So some of the CHWs at APIFM have been focusing on outreaching specifically towards the NHPI community in Los Angeles County for the past few months. So we've continued doing our outreach calls, you know, asking people if they need food assistance, if there are any resources we can provide. But we now have the capacity to call and sign people up for the vaccine, even being able to connect with the county and co-host mobile sites and having someone there that can translate into NHPI languages. But there's so much more to getting the vaccine than just signing people up, along with the physical barriers like transportation and technological accessibility, which has been mentioned before. So I'm not going to go into too much about that, but there are also trust barriers and trust issues within the community. May I get the next slide, please? So before I start talking about what we're doing to address it, I'm just going to talk a little bit about trust. So that's one of the main barriers we faced in our outreach, and that's trust in regards to government entities that have made like false promises, that have exploited people of color in the past during clinical trials and such. And once you lose that trust, you tend to be a lot more hesitant of any information that comes through. And that's why our community health workers are some of the best people in the best positions to learn, to give accurate info, and help the most, especially since we have similar cultural ties, we have trusted relationships. And one of the things that have been successful in building this trust is engaging community members directly, calling them, providing them with a space and letting them know that we have these resources and information for them, and then letting them spread that word to their networks. So just a sense of community as a whole within the Pacific Islander networks out here, and also connections through faith-based organizations, which is where a lot of our elders are. So those have been a huge help in allowing us to work with each other to dispel, to address any questions and dispel any myths. But again, word of mouth was huge, and not only a huge cultural aspect, but a big portion of our outreach work, because after signing people up for a vaccine, we became a source for more people that they know. And as of late, with more and more phases being like phases of eligibility being pushed through, and with word of mouth of the vaccine being safe, there's been an upsurge of interest, and we've been able to engage a lot more people. So as CHWs, we just continue to be very transparent in the information that we're sharing, and also in knowing where people can receive official verified info and resources. And a huge aspect of that is making sure that flyers, infographics, and just information in general is available in our languages in various translations and formats for CHWs to pass out to the community. And in regards to NHPI languages specifically, I know there's a really good toolkit on covid19.lacounty.gov/NHPI, where there's a comprehensive document with a bunch of flyers, videos in like Samoan, Chamorro, Marshallese, along with a couple other, yes, and I linked it right here. Our own APIFM website also has infographics in various translations. And when formulating this info, we also want to keep in mind that there are cultural barriers, such as traditional methods of medicine versus Western medicine. So taking all this into account is a necessity, along with not invalidating people's beliefs, because there are reasons why some of these myths have popped up. As I mentioned earlier, trust. And as CHWs, we have to be attentive to not blaming the community for not having the trust. It's not our fault. We don't always trust the government. There are historical pieces as to why, which I went over earlier. So it's really complex, this issue of the vaccine and how people feel about it. But from my own experience as being a vaccine navigator, having that trust piece is so essential to tackling misconceptions. So that's why through the regional teams outreaching to the NHPI population out in California, like the Inland Empire team, the Southern California team, just to name a few, that's why having these dialogues and talanoas or discussions with the community is so necessary. So they can ask us these questions, we can understand what their fears are, where the most hesitancy lies, and then we can address it. So it's trying to figure out where people get info and tapping into that, whether it's through faith-based organizations, hosting call-ins for our elders, finding out the barbershop everybody hangs out at and leaving flyers for them. But so yeah, this is a continuous work in progress, monitoring and evaluating what methods are working best, and attending webinars like this and learning from each other what's been working is essential. So if you want more information on the API Forward movement, I've included our website in the bottom left, along with an image of some of the translations we have. And on the right side, this is the NHPI toolkit I mentioned earlier, with a variety of different materials in different languages. And if you'd like more information on any of this, please feel free to reach out to me through the chat. Thank you to everyone that's spoken already and will speak, and thank y'all for having me.
Thank you so much, Amelia. Thanks for bringing your expertise and being here today. Next, I would like to introduce Kaupuni Kama from CHW from Hawaii. Kaupuni, you can take it away. Thank you so much.
Aloha, everyone. Mahalo to AAPCHO and NACHWA for inviting us to share our story today about the work that we're doing in our community. Again, my name is Kaupuni Kama, and I work for Kula Nona Po'e Hawaii o Papakolea Kevalo Kalavahine. We are a local nonprofit 501c3. We were founded in 1992 by a group of community women who are looking into the educational needs of our students and children in community. We do serve the Hawaiian homestead communities of Papakolea, Kevalo, and Kalavahine. So our situation is a little different because our community is a federal lands trust program that you are required, lessees who reside here are required to be 50% Native Hawaiian. So everyone that we serve, all of their homes have Native Hawaiians in them, and that's a population that we focus on. We also serve the larger Honolulu area, but we do focus on our Hawaiian homestead residents. We focus on education, health, and cultural programs, focusing on our elders, our kupuna, and our keiki, who are our children. We have 9 board members, we have 17 staff, and we're actually really proud to say that we have 8 out of 17 that are community health workers, and 7 out of us were born and raised in this community. So we feel very strongly as an organization that you're so much more powerful when you were raised in the community that you serve. And so I'm neighbors to our participants, and it's been an amazing experience. This is a picture of we call ourselves the Kula crew. We are women heavy. We at Kula say, we the women. So we do have some men, but we are a strong female force. And so next slide, please. So just a little snapshots of what we at Kula have done during COVID. So usually we have our, just like everyone else, we all have our different programs. We focused on our kupuna, our elderly programs, and then we had an after school program, and COVID hit. And just like everyone else, we had to get very creative. And so, COVID kind of for us took away some opportunities for our children to really experience some of those things differently. We had to find a new normal. So these are pictures of our drive-through graduation, the class of 2020. Nobody really got to have that moment of acknowledgement. And for us, it was very important to still have that opportunity for our children. And then on the right, we have pictures of a world that Kula has never entered. And that is food distribution. When COVID hit, everybody went into panic about food security. And we as an organization had never entered that realm, but knew that that was the first thing that needed to be addressed. And so through community partners and organizations, we enter the world of food boxes. And we actually have weekly food distributions on Friday, 300 food boxes to Papakolea and the larger community now, because that need is the first for us. But in 2020, entering this realm of food distribution and trying to reconnect to community, we are serving more Native Hawaiian families than we ever have before, because something interesting happened during COVID for us in our community. In the Native Hawaiian community, there's a little bit of shame to ask for help and to be okay about accepting help from anyone outside of our immediate family units. And COVID created this opportunity where all of us are in need. And it became this equalizer where it's okay for all of us to understand that we have to get through this together. And so 2020 was really a time for Kula to engage and connect with community and families that we've been neighbors for over 20 years, but they've always been like, oh, we're okay, thank you, no need, we're all right. And during COVID, we've reached families that we never thought we would. And we've built this rapport and this connection with the community and the trust. Yeah, I've seen other panelists speak to the trust that has to be built, especially in this time And really 2020 was KULA building that with our community members. Next slide, please. So as far as COVID testing and vaccination, oh, sorry, one back, there you go. So we were, oh, here we go, there you go. So in May 2020, we are not a federally recognized health center. We are not a clinic. Anything that we do, we partner with neighboring either hospitals or pharmacies. We are located in urban Honolulu, so we are very close to some of the major hospitals in Hawaii. And we have really good partnerships that allow us to provide these opportunities to our community members. And again, through that trust that our CHWs have built, over our lifetime. For some of us, we were raised amongst the people that we serve. And for us as a community, the elders, they kind of run the show. And we're so blessed that the elders in our community were not hesitant about the vaccine. And they were actually right now we have our second Kaiser Permanente clinic is actually happening right now outside our office. So after this, I gotta go get my second shot. But we in 2020 were able to host 2 drive-through testings. And then again, we are hosting vaccination clinics in partnership with Kaiser Permanente today, for example. But what we've noticed is that some of the concerns and needs, Papakolea is located on the hillside. So a lot of our homes, majority of them have between 10 to 20 stairs to enter or exit. And so we have our elders who are homebound. So we're now asking the question as CHWs, how do we get to them? There aren't a lot of access to mobile units right now in Honolulu area. They are working on that. So that's something that we as CHWs are keeping an eye on. Something else is the lack of communication or maybe just some misunderstanding. There's some, of course, concerns about the effects of the vaccines. And, we're going to work on an education campaign for that. That's our next project. We need to get some brochures and information into the hands of community. And then, let's see. Oh, and the other one that we've had is just some personal or religious beliefs. We've had the conversations with some of our community members that we've built trust and rapport with. And we are kind of surprised that there are a few that just, whether it's, we don't know if it's lack of education or just some of them just tell us, oh, we want to just see how this plays out. So we're kind of coming up against those conversations. But again, the trust and rapport that we've built last year has really allowed us to serve our community and be an open door for them. And we all understand that we're in this together. And it's been so good to hear about everyone else in the work that we were all doing. So mahalo for inviting us. We do have, I think in the next slide, we have our website and our email. But God bless everyone. Take care and mahalo for the opportunity to share. Aloha.
Thank you so much, Kaupuni, for sharing your expertise and everything you're doing in Hawaii. I'll now turn it back to John.
Great. Thank you so much. Thank you to all of our speakers. We will have some questions sometime, so I'm going to just go through the slides, and then for the folks who can stay and want to ask some questions, feel free. These are lists of resources: the Health Center Resource Clearinghouse, the HRSA Health Resources and Services. Sorry, my window's blocked. Link. So these are just various federal resources that may be helpful to your work, and we wanted to share it. And again, it'll be in your slides when we send it out through email. NACHWA and AAPCHO are strategic partners to the Morehouse School of Medicine's National COVID-19 Resiliency Network, the NCRN, and this is the link to that webpage. AAPCHO has been collecting resources for community health centers, but there's also information there that may be applicable to your work. Please feel free to visit us at coronavirus.aapcho.org. NACHWA also has a COVID-19 resource webpage. Aurora, would you like to?
Yes, we also just have another repository of COVID-19 specific resources. We also have some specific resources and trainings specific to CHWs to help answer questions and develop strategies.
Thanks, Aurora. We do want to recognize the the folks who are also allowed us to have this webinar happen. So our funders, the HRSA, Health Resources and Services Administration, and again, the Morehouse School of Medicine's NCRN, who we just mentioned. If you'd like to get a hold of AAPCHO, please visit us at apcho.org and visit us on any of these social networks. We'd love to continue to communicate with you and answer questions and build and work with you all. I want to thank everyone for being able to stay. If you were able to stay this long, Joe has posted links in the chat for the various resources and also a survey for today's webinar that we would love for you to fill out so that we can continue to improve these offerings and events for you all. We will keep the room open for another 10 or so minutes. I appreciate the speakers if you can stay. I understand that you're all very busy or need to take some shots of your vaccine. So if you can stay, please stay. If you can't, I thank you again for being here. We learned so much from you. And again, we'll keep the room open for a little bit more. Please send questions through the Q&A. You can raise your hand and I could unmute you possibly if I could find you through our list, but please, we'll keep the room open. And speakers, you can unmute and open your cameras if you'd like. Okay, I'm going to open up the Q&A box because there's been some. There is a question here that maybe you could all answer. For CHW panelists and attendees, what advice or recommendations do you have for organizations who want to support their community health workers as they work to educate and increase access to the vaccine? We've heard some of the pieces about what's been helpful, but if you'd like, this is some more opportunity for time to share about what's been helpful, if you felt that you couldn't share as much earlier. Would anyone like to take that on?
I can hop in.
Sure.
Okay, sorry, my laptop died, so I'm on my phone.
Oh, thank you for.
I think something that's been helpful is fully exploring the website and resources, like going in as if we're signing up for a vaccine and checking out the My Turn page, and honestly just navigating ourselves and making sure we're experts to the best of our abilities in what we think our community might need. So that's like learning the various different websites so that we can be able to explain it to them. Because like as CHWs, we have like our own trainings and our weekly meetings, and then we'll go on together, like share the screen and then navigate the website. We'll ask each other questions as if we're community members and try to like figure out what our community would want us to be able to help them with.
Thank you, Amelia. Lucy or Kaapuni, would you like to share anything, or Lizelle, Evelyn, Nabin?
Well, I think as an organization for us, our CHWs have used all of our pre-existing programs to share education about the vaccine. So it's not specific to any one program, right? This is an organization-wide movement. Everybody's on board for this. And that's really been helpful because, you know, we're sharing information about the vaccines at our food distributions. I mean, that's just not something that you would put together, but we're going to use that opportunity to say, you know, to throw either postcards or information brochures about the vaccine. And so even if families aren't calling us about that, you know, they understand that we as an organization are promoting this and this education. And so we're using every opportunity that we have to connect to push. And that's, you know, some organizations might want to just focus on certain programs or things, but I think as an organization, for everybody, all programs to be on board is definitely going to be helpful for CHWs.
Amelia shouted that out too, in terms of the food distributions. We've also heard that from some of our other partners too. And it's what many of you said about meeting people where they're at. Nabin, you unmuted. Do you want to share something?
Yeah, hi, John. Can you hear me?
Yes.
Oh, okay. All right. Thank you. Thank you so much, everyone. It was very insightful, stories hearing all you. I just want to share something that we have observed, after like almost a year, we're kind of very stay away, stay home, right? That kind of scaring, information that we have been very good to, telling people and scaring people. Like that's something I was very, very looking at, and then hearing from our, special people, our folks, and then slowly that as we get better, situation is slightly getting better, and then we started to see in person. That's something our population, our people, that's what we're very good at. We like something very real instead of virtual. I know this is very new, right? But it's still that's a very natural. That's what we like to see, talk, laugh, do whatever we want to do it in real. And then as we started for the last few months, people are very happy. We're very happy to have that real connecting with them and talking and, listening them, heard their story, that really helped. Not only that talking with us, making our program great or implementing, but that also has impact, that should have or must have impact to our policy level, funding, resource level. That way, the resources are, we always talk about, some kind of inequality and equity, right? We're always fighting for equity. That's where, things gonna go straight to the policy level, funding resource level, right? That way we can allocate resources for this. We always talk about the specific population, vulnerable population. That's where my and our heart goes to. Like, for example, bed-bound, homebound, 65 and plus, people, living with multiple medical complex situation, special need, medical disability, mental disability. So what we have been done so far, are we really thinking about them? For me, those fragile populations should be the prior, on the top of the list, yeah, for every one of us, if we really care about, people. But I just want to ask, any folks has some sort of success story reaching out those folks in terms of COVID help or in general? And now we're talking about, vaccines. So how can we reach, because that's something we have been still struggling, reaching those folks out there, because, the traditional way, the way we do like appointment, calling, telling people, that doesn't help, that doesn't get there to them, So how does that work to them? How can we get, those people get covered in terms of vaccination when they're ready? So I just want to hear any story, any success story from any other folks. Thank you all.
Thank you, Nabin. Would anyone like to take on that question or about successes or share on top of what you've shared? Well, I think we heard I think we heard a lot of different avenues like that you shared as well, Nabin and Lizelle and Evelyn, Kapuni, Lucy, Amelia, Elaine, Dr. Channel. There's so many efforts that you're all doing. I think there are many successes. I appreciate the question, and I'm going to leave it open if people want to answer that. We're about almost at time, but there is a question, another question from the audience, and then this will be our last one, as well as with Nabin's, if anyone would like to answer it. How are people reacting to the different versions of the vaccines and the variations of the virus itself? It's a pretty large question. Would anyone like to address that, or maybe how you would address that?
I have an observation from the community to share. So a couple things about the 3 vaccines that are currently available. Some of the community members have asked if they would be receiving the Johnson & Johnson vaccine, and then we explained to them, no, right now we just only have Pfizer or Moderna. And some of the community members have expressed, like, thank goodness I didn't want the Johnson & Johnson vaccine anyway. And some of the reasons, because I whenever I'm down in the clinic, I just kind of survey people because I'm just that kind of chatty person. But I've asked them, why do you not want the Johnson & Johnson vaccine? And I have heard responses that range from, well, isn't Johnson & Johnson the the company that had the talcum powder lawsuit. And these are the Black community members that you know, they speak English, so I'm just talking to them, and they have responded that way. And then other community members who do speak other languages, you know, if they speak Chinese, then I can communicate with them. But I've also heard from Chinese community members who have said, oh, they don't want the Johnson & Johnson vaccine because it had reported a lower percentage of, you know, the success or outcome with that vaccine. And so they didn't want it. But I've explained to them, you know, the purpose of the vaccine, you know, there is no 100% vaccine. The purpose of the vaccine is to prevent someone from having a very, very serious reaction to the coronavirus. And even then they were not convinced. So those are some of the things that I have heard and observed.
Thank you, Elaine. I think we've heard some of those as well, and I think some of that's new. There's also other concerns that we've been hearing at various meetings, national meetings this week, about some religious concerns about Johnson & Johnson vaccine, and also the perception of it being less effective, and that being shifted towards communities of color, and that's landing very not well, because the communication isn't there in terms of like effectiveness and stuff. So we know that the CDC is working on more vaccine information, and I think continuing to advocate to them about translated material or transmitted material is going to be a big step, as you all talked about. I do want to recognize that we are now 2 minutes beyond our extra time, and so I do want to thank our speakers, and I want to honor your time. Thank you all for being here. Thank you for the participants who were here earlier and who stayed on. We look forward to doing this again. Thank you, Aurora, for partnering with us. And you all have a wonderful day. Thank you.
Thank you, everyone, so much.
Thank you, everyone. Mahalo.
Thank you. Nice to meet y'all.